Okay, everyone, Dr. Bland here. It is August 1st, and this week in 2021, the CDC has changed a bunch of their recommendations based off some new information they have about the Delta variant. It has caused a lot of questions, so we're going to break through what those new recommendations are, what data they use to try and come up with those, and then we'll kind of wrap up with some of the implications it seems to be having in terms of how governments are acting and some of the different federal employers and healthcare systems are acting. Okay, so to just summarize the list of new recommendations that the CDC has come out with, the first one is that if you are vaccinated and in a high-risk area where there's a bunch of transmission going on, that they want you to continue to wear masks. If you're wondering if you're in a high-risk area, the answer is probably yes, but the link will be below to where the CDC goes county by county and tells you if your area is considered high risk. They also suggest wearing masks even if you're vaccinated, if you are a high-risk person, if you have a bunch of comorbidities that put you at a higher risk of a bad outcome from COVID. There are other recommendations, including that if you are vaccinated and you have a known exposure, they say you should get tested 3 to 5 days afterwards. The notion if you don't get tested and you don't get a negative, your home isolation is now recommended to be 14 days, which is different than the 10 you might have been used to in the past. Another one that is particularly important as we're coming up on August, and the American Academy of Pediatrics just put out a statement recently that agrees with this. The CDC is recommending full universal masking for people over 2 when they go back to school. So that'll be some things to kind of get used to. Part of the question is, why is the CDC coming up with these recommendations? What data did they have? For a while, they were just referencing data, but now it's been released. I'll put a link below so you can see the study that I'm talking about. Let's get into this data. This is from Massachusetts, and they had a bunch of COVID cases after a lot of outdoor festivals where people were around each other, breathing without masks, and here's what they came up with. So when they looked at all the cases they had in this Massachusetts area, they had 469 cases of confirmed COVID. When they went through that a little bit further, they found that 90% of the ones that they actually did the variant testing on, it wasn't on every single one, but 90% of the ones they did the variant testing on were shown to be one of the Delta strains. So that is a lot of Delta. A lot of the stuff flying around this Massachusetts area was Delta. The question that has really brought stuff up is how many of those were vaccinated. That answer was 74%. So 74% of the cases that they caught were folks who had been vaccinated. Now that sounds like a lot, and it might make you start to think, well, that's more than 50, or is this vaccinated people are more likely? And that's not the case really, because of eligible people in that area, 69% had been vaccinated. So it kind of evens out a little bit to where, at least according to those numbers, now the population is too small to make wide-reaching implications, but according to those numbers, a reasonably likely possibility of ending up with a breakthrough COVID case if you are vaccinated versus not vaccinated. That's what those numbers were showing. And they also showed that 79% of those who were vaccinated had some sort of symptoms. And these are not hospitals. This is just some sort of symptoms. So of the 469 cases, 5 of them went to the hospital. 4 of those who went to the hospital happened to be vaccinated, and 1 was not. Again, in an area with roughly 70% vaccination, that seems to kind of make sense. But those are some of the raw numbers that they had. 469 cases, 90% of those being Delta variant, and over 70% of those were people who were already fully vaccinated. That's both doses of the 2-dose and then the 2-week waiting period, or the 1 full dose of the Johnson & Johnson, which is a lot more post-vaccination COVID than we had initially been hoping for. So you might be asking then, well, there's 3 different vaccines. Was one of those vaccines maybe more effective or not? Again, these numbers are too small to come up with really great ideas, but it did seem to somewhat match up with the prevalence of vaccine use in that area. So I'm going to use my cheat sheet here and look at my notes. For that area, the folks who had been vaccinated, who got a vaccine in that state, 56% had gotten the Pfizer, 38% the Moderna, 7% the Johnson & Johnson. And then when they took all those folks who were positive and asked them which vaccine they had gotten, check their records, it was 46, 38, and 16. So 56% in the state had the Pfizer vaccine, 46% of those were positive were Pfizer, 38 and 38 for the Moderna, 7 and 16 for the Johnson & Johnson. Those were reasonably similar numbers. So it doesn't look like we've got enough data there to really make a firm case about which avoids a Delta breakthrough COVID case just yet. So when you try to design a national policy off of 400 cases, you have to admit that there are some limitations. And this study that the CDC has put out is referencing some limitations, and we'll just kind of go over those real quick. One I've referenced a couple times here is that the number is really too small to have wide reaching implications. If you flip a coin 3 times and you get head 3 times, that can happen. Are you likely to get 3 heads every single time you flip a coin 3 times? And the answer to that would be no. So you got to think when the number of cases you have is small, it's harder to make a wide-reaching implication, but that's one of the limitations of this study. The next one is that the detection bias could be a thing. So as we know, a lot of folks have positive COVID, but no symptoms whatsoever, particularly amongst those who are vaccinated and might be feeling more confident that they don't have COVID, even if they've been around some of it in outside or just exposing in their daily life. It's hard to say what % of folks are likely to get a breakthrough infection if you're not testing everybody, right? So there is a detection bias, which could be a problem there. Another problem is that there's a selection bias of adult males, which broke up about 80% of the people that were involved in this study, which is not remotely representative of the general population at large. So there could be some issues there. And once you add in different ages and genders at their more representative numbers, maybe some of the data changes. The other thing that was referenced is that infections deal somewhat in viral counts. If you have 3 particles of a virus, are you as sick as if you have 3 million particles of a virus? The testing that they used was qualitative, not quantitative. So while it did give some data on the number of the virus count, it was not certified as a lab test to actually give a valid count number, and therefore this was a qualitative. This was a did we find it or did we not? And so what we don't have really good data on is, was there a drastically different viral count amongst those who had been vaccinated and those who had not been vaccinated? And there may be some interesting data there once we start getting a decent set of information that actually includes viral counts. So the real question you're probably asking yourself is, I got vaccinated because I thought I might be protecting other people, and because then I thought I would be free of people telling me to wear masks, and now all of a sudden I'm being told to wear masks again, and I am frustrated by that. Maybe that is what you're saying. I'm going to throw it out there. Probably because that's partially how I'm feeling about it. I have been pretty clear through most of my talks about this, you might see this in some of my prior videos, that the data never promised you could never catch COVID with these vaccines. The data that was put out was this will probably reduce some transmission, maybe, but this is just pretty decent at you not getting sick enough to end up in the hospital and die. And so far the data is showing that that is still pretty true. So should you get vaccinated? For most people, the answer is yes, as it is still believed to likely reduce your risk of getting severe symptomatic COVID. That's still a thing. Does a vaccine mean you are less likely to give COVID to somebody else? This study from Massachusetts seems to question that and say maybe it does not mean you are less likely. Now, again, there's a bunch of limitations to this study. Who knows? Maybe the CDC will come out next week and change their mind again. But it does seem like there is a reasonable amount of people who've been vaccinated and exposed to the Delta virus and still get enough of a viral load in them to qualify and test positive as having COVID. You can get COVID after you're vaccinated. That's a thing. The idea that masks still probably reduce transmission, I think, is still true. In one of my last videos, I put out a study that talked about the notion of population masking and does it work? And it seems to reduce transmission of respiratory viruses. So vaccine to cut down my risk of dying of COVID, deal. Vaccine to stop my spread from everyone else, that's now a question mark. Mask to protect myself, really the idea of vaccines is probably better to protect myself from getting symptomatic COVID. Masks to maybe protect transmission to other people, I think still is a reasonable idea. The question that you're going to have to deal with, and you're going to have to navigate your own personal life and your own geography with this, is how's your school district going to deal with this? How's your healthcare systems dealing with this? If you're a government employee, how are they dealing with this? Because we now have the idea of more enforced vaccination and vaccines and masking going on. Healthcare systems are starting to require it of employees. The federal government is now saying that they are going to require it, and if you do not do it, that you'll have extra testing and masking and isolation required. There's going to be a lot of ways that a lot of people try to navigate this information, which keeps changing as we find out more. So pay attention, try and do the best you can to be safe for yourself, and just understand that at all times, we're only working with the information that we have right now, and there could always be more in the future. Do the best you can. Be safe out there, y'all.